Opening the state of North Carolina safely, COVID-19 in the Carolinas. As we go through the pros and cons of fully opening the state, let's look at the data to see where we stand regarding how COVID has affected our state. As you can see from the then and now chart, our numbers have decreased since we had the vaccine on board. If we look at the following chart reflecting the African American population in North Carolina, we are not doing well. The new report cases and hospitalizations, 21% and 28% respectively, would not sound bad for general percentages. But when the death is 50%, I feel we have a lot of work still to do. On March 11, President Biden signed into law the American Rescue Plan Act of 2021. It allotted $10 billion to combat the COVID-19 pandemic for its procurement of medical supplies and equipment. There was also another $70 billion for COVID-19 vaccine, testing, and workforce effort. $15 billion was geared towards enhancing, expanding, and improving the nationwide distributing and administration of vaccine in underserved communities. These will be the key to opening the state. Testing, giving vaccines, and continuing our 3 Ws, washing our hands, wearing our masks, and waiting 6 feet apart. The African American population is scared from the beginning of this pandemic regarding medical treatment. Many do not trust the vaccine, so they will not get one. The goal for the state and the country is herd immunity. But because this vaccine is so new, we do not know what percentage of how many people must be vaccinated before we reach that goal. In the American Rescue Law, $47.8 billion was allotted towards evidence-based national testing strategies to detect, diagnose, track, and monitor. It is important to have surveillance testing because there are several people who are asymptomatic and are passing the virus without knowing. Most colleges have requested students living on campus or in-person classes to agree to surveillance testing 1 to 2 times a week. Testing is also used for people coming out of isolation, giving the instructor or their bosses the verification for their return. We can see from this slide that vaccines are working. 47.7% adults have had at least one dose of the vaccine, and 37.3% adults in North Carolina are fully vaccinated. Our daily COVID-19 percentages have gone from 15% to 5.1% since the vaccine. We are closer to the population immunity, and we cannot stop now. We need to be getting our vaccine numbers up and our new cases and hospital cases down. Work in our rural areas with our African American neighbors and educating them on why it's crucial to receive the vaccine. The lives they save by doing so. If we cannot get them vaccinated, we should at least have a testing site accessible for them to get tested regularly. We are educating them on the early detection of the virus by doing this.